So, to celebrate Global Health Trial's 5th birthday, we're going to be interviewing the Principal Investigator, Trudy Lang. Thank you for talking to us. So could you tell us, what was the inspiration behind Global Health Trials?
Well, we set up Global Health Trials 5 years ago after we've been working for some time in East Africa with a whole group of research sites across Kenya, Tanzania, Malawi, and that whole region, trying to increase clinical trial capacity. And what was really evident was that it doesn't matter whether you're working on malaria or HIV or maternal health, but actually all the issues and challenges are exactly the same. So we'd worked to put together some ways to help groups in those areas, and again, it wasn't even down to that region. So what we did with Global Health Trials was set up a platform where the idea was if you were wanting to set up a research study and you didn't have a big research site around you, you had nowhere to go to get the training and tools and resources and so on. So the idea for Global Health Trials was simply that you could have in one place everything you need to sort of plan and operate a clinical trial.
Thank you. And what do you think is unique about the Global Health Trials community?
Well, I think the big difference with Global Health Trials is that this has been deliberately for all diseases, and up to then, any capacity development activities, apart from there wasn't really anything else online, but anything that had been done was all around one disease or even one protocol. So, and the point, as we've just been discussing, is that it doesn't really matter what sort of trial it is. And so all these initiatives that were around, which were just training sites to work on a HIV trial or a malaria vaccine, were fantastic and brought loads of new skills and resources to that site, but they were limited to that study, so they weren't really sustainable. And it's not as if a whole village in Africa just has malaria or another village just has TB or HIV. And sites and research centres and health organisations need to be able to run lots of different studies and look at all the different things that are going on in that community. So there is a need for having the skills and resources to run all sorts of different trials. And so what's different about Global Health Trials is that it's for all diseases, all regions, and really importantly, all different types of staff that are involved in clinical trials to give them what they need to set up a study.
Thank you very much. And what do you see as the future for Global Health Trials?
Well, what would be great is if it becomes much more regional. So from the outset, it was a really collaborative activity, and lots of people got involved from Africa, Asia, India, South America. And now we've got some really great regional faculties where they just take the idea and the concept of Global Health Trials and they do their own things in their areas. And so we've got really strong activity in places like Cameroon and Cape Town, and increasingly in South America and India. And that would be great if that got picked up even more and people just took it their own direction, did what they needed to do in their own cities and regions to share knowledge and information about clinical trials to support more and better trials in those regions.
Excellent, thank you. And why do you think that people should contribute their time and knowledge to this community?
Well, I think people actually really like sharing, don't they? And I think what we all know is everybody loves using Facebook and LinkedIn and TripAdvisor and that sort of thing. And so people happily share whether they've been on a good holiday or eaten in a good restaurant or watched a good film. And that's a really powerful thing. It's called the sharing phenomena. And if you put that in this context, it's called the community of practice. So this is a group of people who are expert in something helping another group. So we've had research nurses in Nepal helping research nurses in Malawi build up a community engagement plan or something like that. So I think what's really exciting is the idea of people using this sort of sharing idea much more and using this digital technology to do it. And people like it because they actually like to share, and they share what works. And so that's the incentive for people to do it. So these nurses in Malawi did a really good job and had a real success with their community engagement plans. So they got a lot out of helping another group do the same. And that's how we can sort of improve clinical trials in different regions, by telling each other how we did it and what worked and what didn't work. So I think that's why people do it.
Excellent. Well, thank you very much for taking the time to talk to us on Global Health Trials' 5th birthday.
Thank you very much, and I just want to thank everyone that's taken part in Global Health Trials over the five years. It's been huge collaboration with lots and lots of different groups and organisations being involved, and really that's what the Global Health Trials is all about. Thank you.